Well, good evening, everyone. We have appreciated you hanging out with us all tonight for our special segment of Ask the Medical Expert here on News Channel 5 plus OpenLine. We do have a call that we want to get to. I believe we have Betsy on line 1. Hi, Betsy. What would you like to say?
Yes, I'm calling to mention about the resources after you go through mental health treatment and addiction treatment. In Nashville, there does not seem to be a program that will help you with the resources. We do seem to get stable housing, but once we get into stable housing, there are problems like insects and bed bugs and being bitten by bed bugs and ticks. So when you take that kind of problem to mental health, to your doctor, even calling the mayor and writing letters to the Attorney General, there's been no help for people in our situation. So we still are almost getting ready to be homeless again. And again, my problem is the mental health cooperative or places like that, they don't have any additional help for you. They'll give you resources, but none of them will help you with your situation as far as the stable housing, as far as the bed bugs and things like that. And mind you, these people are getting vouchers from HUD. HUD pays the money for these apartments. The tenants pay the rest, and they are making them live with bed bugs. And if they disagree on not wanting to live like this, then they the housing will go ahead and try and evict them.
All right, thanks for the call, Betsy. We appreciate it. Can you touch base on that?
So, in general, one of the issues with public services in general probably is the siloed. All the different services, unfortunately, tend to be siloed. I empathize. Thank you. You got some great exposure for the issues that you're dealing with now. So hopefully we can bring some light and attention to that. But all of the different agencies are siloed, and so it can be very difficult, especially if you are in the grips of the symptoms of your mental health disorder or your substance use disorder in managing those pieces. There is a resource that maybe not designed specifically and only for this, but the Tennessee Red Line. I would suggest going ahead and giving the Tennessee Red Line a call, seeing where they can help you. I know that they have a wide spectrum, a wide reach in terms of all of the mental health and substance use disorders and the support services that go with those. So perhaps that can help.
Great. Now, I know in our last visit, when we had you here on OpenLine, we talked about something that you definitely wanted to touch base again on this show. And it's talking about heroin. It's more dangerous now than ever. Why is that? What's happening?
So first, heroin being more dangerous than prescription opioids, because clearly it's made in an unregulated and uncontrolled environment, right? So that's first. Secondly, the way that heroin is used via IV injection or inhaling it is more dangerous because it's very difficult to manage the dosage in those, and you have a very instantaneous access of the active ingredient of the drug to all of the different important body functions like breathing, like your heart operating. But also what we're seeing is the use of fentanyl, carfentanil. Heroin's being cut in different ways with very strong substances right now, and you just don't know what is in there. In fact, all of the different drugs, methamphetamine, any of the drugs that are made or processed illegally, you just don't know what's in there. And
is that to increase the high that you receive from those types?
It's to increase the high, but it's also to make it stronger. So it's not even that. What we see is that there's a great deal of overdoses because of it as well.
Okay. Too, there is such thing as a functioning addict. We're talking about substance abuse, drinking, drugs. Go into that, maybe some signs that people can look for, because it's possible to be the functioning addict.
Well, okay, so it's possible to function and be an addict at the same time. I'm not sure that, and it's so you know, the nature of chronic disease is that it's progressive. If you have heart disease and you make no changes, you continue doing the same thing, your heart disease will progress and it will get worse. It's the same thing with substance use disorder and this concept of functional addict. So especially when we look at the opioid use, one of the characteristics of opioid use disorder is, and using opioids, is tolerance, which means same with alcohol. Which means over time you need more of the substance to achieve the same result. So that's part of the progression of the disease. And so what you see is you're going to need to drink more and more to achieve the same result. You're going to need to take more and more opioids to achieve the same result. So at a certain point, the functional piece is a myth. It's no longer there. Now, the addicted individual, the person who's suffering, may not recognize the level of deterioration, let's say, of their functioning. That's one of the biggest barriers. That's one of the tricky parts, is really having that honest conversation that says, you know, you're not yourself anymore. Your grades have dropped, or your work performance isn't the same. You know, what's going on?
What are the right questions to approach someone with if you do see those changes in behavior?
Probably just what's going on. Why am I seeing these changes? I think it's not so, you know, so often it's not what we say to someone, it's how we say things. So at the end of the day, to have that conversation that's inside of a space of, I love you no matter what, or you're important to me, and this isn't going to change that, but I care and I'm concerned. There's a lot of shame that goes along with having a substance use disorder. Most people who are caught in the grips of this disease recognize that this is not what they had, you know, the way they wanted their life to show up. And yet, as much as they want to stop using, one of the big symptoms is you use against your own will. And so really approaching the individual, you know, from a place of love, from a place of understanding, and from a true heartfelt desire to help.
All right, I believe we have Jeff now on the phone. Hi, Jeff. What can we help you with this evening?
Well, one thing I would question is like addiction. Like I've been addicted to cigarettes for 40 years. And this is difficult. I mean, I've been addicted to crack. I've been addicted to alcohol. But cigarettes is probably the worst addiction that I've ever had in my life. Okay? And like I have beaten crack, and I'm working on alcohol. But cigarettes is definitely one of the worst things I've ever dealt with in my life.
Thank you so much for the call, Jeff. We appreciate it. Any advice on that?
Yeah, so there are tons of resources these days to help deal with nicotine addiction and tobacco addiction. I would reach out, you know, check the internet, reach out. There's so many different medications and treatments, you know, everything from gum to patches to actual oral medications that can support you know, being relieved of your nicotine addiction. So, so yeah, I think it's great that you're willing to address it. Congratulations on moving forward.
That's wonderful. We do appreciate those calls so much tonight. This is just supposed to be, you know, inviting us into your homes this evening to talk about important issues that maybe don't always get discussed. So we want to thank you for anyone who called in this evening and for tuning in. But I also want to remind you that if you didn't call in to us this evening live on air, that's perfectly fine. We understand. But don't worry, there is the number that you can call. And again, that is the number. We're going to pop it up eventually here on the screen at the end of the show. It's for Foundations Recovery Network. Actually, we'll go ahead and get up right now. There it is, 615-371-4091. You can go to the website there, frnhelp.com. Foundations Recovery Network, again, Siobhan, maybe folks are catching us here towards the tail end of the show. What is it, where is it, and why is it important?
We have 3 locations here in Tennessee, 2 locations in Memphis, 1 here in Nashville, as well as locations all around the country, including Atlanta and California and Michigan and Chicago. We provide everything from out outpatient to intensive outpatient to partial hospitalization and residential care for substance use and co-occurring mental health disorders.
You know, we've had so many great calls this evening, and we've talked about a ton of great topics, but I want to ask you, as we wrap things up this evening, you know, as the Division Director of Clinical Services, what would you like to talk about before we say goodbye tonight?
So if you or someone that you love is struggling, don't give up. I think that's really just the most important thing. Don't give up. There is help, there is hope, and you can recover. Give us a call. We want to help you through this journey.
You know, do you all have any sort of help for those who maybe are dealing with a loved one on the other end of things? Let's say you have someone in your life, a child, who is suffering with addiction or opioid use, maybe depression, anxiety. I'm sure there's that tremendous feeling of guilt, or, you know, what could I have done? Is there any sort of help that people like that can seek as well? So everyone that attends our treatment centers, their family's invited to come to family session, family workshops, family groups. We also have at our facilities some open meetings and open education as well at many of our facilities. So I would encourage you to give us a call, see how we can help if maybe you're near one of our centers, or a referral partner that we can share with you, and you can go learn more, and we can get the family members help as well. Yeah, I think it's important to talk about that side of the issue as well.
Yeah, absolutely.
Let's talk about Heroes in Recovery. What is it? We discussed that last time, I believe. Can you refresh us on that?
So Heroes in Recovery is about breaking the stigma. It's about the movement. Recovery being one of the largest social movements of our time. There's a website, Heroes in Recovery, as well as we host 6K races to celebrate recovery and to help break the stigma.
All right, great. You know, for people, again, unsure if they should call or not, remind them why it's important to not wait. That is a crucial aspect to this entire conversation we've had tonight. Why shouldn't we wait?
So one of the major leading causes of death right now is overdose. And rarely does somebody intend to overdose, right? So, you know, the biggest part of the conversation is about new possibility, is about getting hope, is about something new is possible for your life. And moving forward and living that life that you were born for, you know, living that life that you want to live. That's why you make the call today. Not because you're afraid of what's in your past, but because you're hopeful about the future. And if you're not, let us help you become hopeful. Well said. And my final question tonight, you know, Foundation specializes in a lot of important elements in getting folks back on the right track. But again, to reiterate that wonderful motto, creating lifetime relationships for long-term recovery is so important. We'll end with that. Yeah, so as it's relationships are the most important feature once you begin this journey, is developing positive relationships in your life and that support. And so we'd like to help and be the first one and start there with you. All right, any final thoughts from you, Siobhan, tonight? Again, don't wait. If someone that you love is struggling, if you just have questions, if you don't know if you even need to call us, go ahead, call the number that was placed on the screen, and let us direct you where you do belong if it's not with us. A wonderful conversation yet again tonight with Siobhan Morse, Division Director of Clinical Services with the folks of Foundation Recovery Network. Thank you so much for tuning into News Channel 5+. Keep it right here. We've got Southern Woods and Waters coming up right after the break. Thank you so much for joining us tonight. I hope you all have a great rest of your week.